Hi,
Hello.
everyone. Let's get this started.
Welcome to our Zoom. So this is the M Beauty Clinic Solutions for GLP-1, Ozempic face, skin, and hair, and basically just the cosmetic side effects besides weight loss that can happen when you are on a GLP-1. So we are M Beauty Clinic, and we've been in practice here in San Diego and in Beverly Hills in the LA area for the last 22 years. I'm
Wow.
Angela. 22 years. I'm Angela. I'm the lead RN for the practice. Also, youngest sister of Dr. Tess. Dr. Tess, dermatologist extraordinaire, dermatologist to all of the celebrities.
Yeah.
Um, Also a celebrity dermatologist herself, I might add. Stanford Medical School. Good head on her shoulders.
Good hair so
Good
far.
hair, good mom, good
Thank you.
sister.
Thank
Of
you.
course.
I know there's a lot to say, but we got,
Yeah,
thank you,
we can keep
Ange.
going on and on. We got to
So,
get
so
started.
yeah, so M Beauty Clinic, we have three locations. We are here in our San Diego office. And then we have a Chula Vista, South San Diego office. And then we see patients in Beverly Hills. And for those of you who are joining us who are already part of our M Beauty Clinic family, thank you, thank you, thank you. And like Angela said, it's hard to believe, especially when we look in the mirror, that we've been doing this for over 20 years, and it's been truly an honor for us to have taken care of thousands of patients. And really, our goal is to utilize the best technologies um, and help patients really feel their most confident self to really live your best life. So that's really where we are right now. And GLP-1, and these are really incredible medications, especially for people who have diabetes, metabolic syndrome, if they're at risk for heart disease, if they have insulin resistance, incredible medications. And it's been said that about one out of eight Americans have been exposed and have taken GLP-1
I believe it.
sometime in
Yeah.
their lives now. And it's only gonna, expand. And obviously, as a dermatology clinic,
We
we
see
see
the
the
skin
skin
and
and
hair
hair
issues
issues
that
that
can
can
happen
happen
with
with
any
any
kind
kind
of
of
weight
weight
loss.
loss.
Yeah,
Yeah,
that's true. Yeah. So even if someone were to do the weight loss naturally, I think
yeah.
the main issue though is like when you have a lot of weight loss in a short period of time. So, previously we're talking about maybe bariatric surgery, and then again now more recently.
But it's interesting because there are, research that's coming out that specifically addresses GLP-1 or
Mhm.
semaglutide, Ozempic, Wegovy, the tirzepatide, those type of medications. That there is
Huh?
something different that's happening. All right.
Mhm.
I
We did
think
get married already. I know. Rick,
Mhm.
our brother, please put your camera on mute. He is a
Oops.
panelist, and I think he doesn't realize that his camera is
Well,
on.
it's a family affair, and so at MBD Clinic, we have my
Sorry
sister,
about that. Sorry.
we have Rick as
I was
well.
gonna say, sorry, I was gonna say Angela doesn't have to worry about the weight loss thing. Oh, thank you. Thank you.
We are not on GLP-1s, but there are a lot of patients who are and who may be considering it. And really, our goal today is to educate you, create awareness, and also when you do that, create a plan so that we can support the biologic changes that are happening in your skin. And we'll go over that.
Okay.
So we can start our slideshow. Okay, Lisa will start it.
What
And
does
again,
GLP-1 mean?
yes, so it's glucagon-like peptide. And so up there it is. Right. Okay. So we had a little bit of technical issue in the beginning. And so now we're ready. So like I said, about 1 in 8, and they're estimating between 15 to 30 million Americans
Wow.
are now like, have tried a GLP-1 or on a GLP-1, but it's really getting easier to access GLP-1. And we definitely see a lot of celebrities, right?
Yeah.
There's like Ozempic rumors if they lose weight too fast, or
Yeah.
if they look like they're sagging. The skin has so many more folds. The eyes are starting to become
Yeah, like
sunken,
sunken in.
hollow. All of those things can happen, and I'm going to explain what really is happening from a biological sense. So you guys are going to get a little bit of science that is specific for GLP-1 weight loss.
Okay.
So let's go. Let's go on a science tour. All right. So if you have any questions while we're loading, if you have any questions, you can enter it in the chat. Those of you who stay with us through the whole thing, you're really going to learn a lot. This information, research actually is really brand new. And even physicians, many physicians are not aware of this. And I'm actually going on Fox 5 News Live right after the webinar to talk about this topic, because this is very, very hot topic, because it's
everyone's on it and everyone's thinking about
right,
it
and it's a different category of skin aging. And I'll show you why. Okay, so we're talking about inflammation, aging, and the emergence of a new aesthetic patient. So in the past, obviously, we've dealt with people who've lost weight, like what Angela talked about. And of course, fat provides support to the skin. But what is really not known very widely is that fat is not just for cushioning. It's not just to cushion your skin. It's not just for support, but actually it is a very, very biologically active cell, the adipose cell or fat cell. And we know that at M Beauty Clinic because we are one of the pioneers of the use of nanofat, our patient's own fat, and the use of nanofat and stem cells and growth factors and exosomes within that. So it is biologically active. And so that is the problem when it comes to GLP-1. So here you go. So we talked about the massive global uptake. It's huge. It's going to just be even bigger. I don't think there's any medications, drugs that's going to be as big in history. And it truly is a shift, and it's a whole new category when it comes to aesthetics. So like what we've seen, celebrities or maybe people that the patients are presenting with facial hollowing, skin laxity. There's definitely a change in the skin quality, the thickness of that. The easy way that when you smile or move, things that didn't used to create wrinkles or ripples in your skin will have that, and not just on the face. That's why when we talk about Ozempic face, it's really an oversimplification, because your entire body, the skin everywhere, even your private parts, actually, I've seen that as well, really suffer. And then texture changes because the skin itself loses almost that freshness, the texture almost becomes hard looking.
Oh, I see.
And we'll tell you why that is. And so in literature, it's very early. Like I said, it's evolving, and you guys are going to get the latest. And we are treating with GLP-1 a new metabolic aesthetic patient, because we're not just removing cushion. When you lose weight with GLP-1, you are changing the metabolic and biologic function of your fat cells and your body. So it's something to think about. Next.
I think people don't realize too that when you are losing weight, they're kind of thinking that, oh, it's just going to be my body. Right. And then you don't realize that the fat on your face is actually precious. We are already losing a lot of fat on our face every single year. Yes. And so now you are accelerating that fat loss, and you have to expect that there will be some visible aging that will happen. So I do think that this is a very important matter to talk about.
Right. And, every day, every minute, there's a balance between breakdown, the natural breakdown, and as you age and hormonal changes, you accelerate that. And then there's a balance with regeneration, which is creating activation of your skin cells and fibroblasts to create collagen and elastin. And so when you tip that balance to mostly breakdown and fat loss, your skin is not able to keep up. And then you see all of these changes, plus more, because like I said, metabolically and biologically, you are changing. Next.
We actually have a comment from one of the viewers and said, I love that I've lost the weight, but I hate the way it's aging. So thank you for doing this.
Yes, no, and you don't have to to really, really suffer. And that's really why it's option. So we are hopefully by the end of this, you will feel more hopeful about it. Next. So GLP-1, glucagon-like peptide, there are specific receptors in the skin, which is why when we take these medications, right, it's in keratinocytes, which is basically what makes up your skin. Fibroblasts are the cells that actually create collagen and elastin and hyaluronic acid, and then adipose-derived, which is fat-derived stem cells. Like we mentioned before, we are pioneers of the use of adipose-derived stem cells in skin rejuvenation, hair rejuvenation. And so we know that your fat that you're losing is not just for cushioning. It is, it definitely has other function. And so it has direct biologic activity in your skin, your fat, and you are having a systemic and metabolic effect.
I have a
And this
question.
is actually a published study that's totally new.
So you keep referring to like fat that's not just cushion. So I feel like for maybe non-medical people or non-doctors, like what do you mean by that?
Yeah, so if I took a biopsy of your skin, so there's the epidermis is the top layer, and then there's the dermis, which gives your skin bulk. But part of skin really is adipose, is just right under there. And so think of it, well, I guess if you think of like eating pork or steak, right? So if you lose that fat, your support of that envelope is lost. And so that can explain. Most people think, okay, that's it. That's the reason why I'm saggy. That's the reason why I look older. But I'm telling you, the studies are showing it's beyond that.
I see.
There is an actual biologic reason why the skin is not the same. Beyond the cushion. So this is what happens. So you reduce the fat, you reduce the white adipose tissue, you reduce the mechanical support, and also fat is involved in the vascularity of the skin, so blood flow. Also, more importantly, cell-to-cell communication. So it tells you when, it's like part of the communication network that tells your body to create new collagen and repair and heal, wounds and any kind of trauma. And so also fat has hormonal activity as well, which is why those who have anorexia,
they don't get their period.
Correct.
I have heard of that. I didn't realize that fat was doing this much within
That's
our
what
body.
I told Ange because she's like, is this going to be the same as just like weight loss? And so that's a really great question. And you guys, this is really new data. You can see this one was in Dermatology Times Review 2020.
Wow,
this is really the most recent, literature that we're going over, and you guys are really ahead of most doctors. So this leads to laxity, hollowing, wrinkling, and like to the point of, one of our, participants today, you love how you look in your clothes. Maybe if you were doing it for medical reasons, you love that now you don't have to inject, you don't have to be treated for your diabetes, but you don't love that you look older. Next. Okay, so is it the drug or the weight loss? So evidence suggests it's rapid weight loss. Like I said, you're really tilting that balance of regeneration, breakdown, loss of support, but it is multifactorial, and that's definitely something to think about when you are trying to reverse or prevent the what you see, okay? Because they're mechanical issue, and that's what we're talking about, the cushioning, cellular, the hormonal, the affecting your blood flow, affecting the cell-to-cell communication, and endocrine hormonal issues as well. And then there are potential adverse skin events that happens when you take GLP-1, and in this study, they found that it can cause itching, rash, and even hair loss. And so we're going to also obviously talk about hair.
I feel like 8% is low
in that series.
Particular study, because I just feel like for maybe like my friends and family members that I've spoken to, I've observed it, And I've also like they've talked to me about that. So
Yeah.
again, I feel like in that study, maybe it was that number, but I feel like in general, in the general public and the people that I've been around, I feel like that number is actually higher.
I agree with you.
Yeah.
Most people who are on GLP-1 meds have some skin and hair
Yeah.
complaint. Or worry. Definitely
Yes,
worry.
yeah.
Okay.
We have a question. It says, and what happens when you're going through menopause at the same time? Does it make it worse?
So think of the balance, right? Hormones absolutely play a role. And like I said, fat cells have a hormonal activity as well. And when you're losing your estrogen, you are accelerating breakdown. And so it is how much more? Definitely more. We don't know how much more. It really depends if you're doing treatments to kind of tilt the balance up to regeneration. And that's what we're gonna talk to you guys about next. So here it is, and I'm going to actually be giving this lecture to my colleagues in the future very soon, because really the GLP-1 patients that we're seeing in our clinics are not your traditional aging patients. They're not purely volume loss patients. So fillers alone, not enough. These are metabolically altered and biologically altered patients. And when you're doing fillers or treatments, it is a rapidly changing tissue environment because of that. So M Beauty Clinic, we're really proud to say that we are pioneers of regenerative therapy. So first of all, if you've never heard that term before, regenerative means that we are activating your body's natural ability to heal, repair, regenerate, tilt that balance of breakdown to creating and healing and building. And so this is why it matters, because like I said, there's beyond just volume loss. Traditional approaches, you may go, you feel like, okay, I'm saggy, let's put a filler, and that does replace volume. You can use a laser and it stimulates collagen, but they do not fully address stem cell signaling, inflammatory pathways, and extracellular matrix biology. But our combo treatments, next slide, the regenerative stacking that we do and we have been really promoting, because we believe in this complete and more holistic approach to aging of the skin, really makes sense as well with the biological and metabolic changes in the skin with GLP-1. So we do, with our time machine procedure, we do energy-based devices to really resurface and improve the envelope. And then we would use platelet-rich plasma, your own growth factors, for both natural volumization and also restore the cell-to-cell communication that's lost when fat is lost. Exosomes and polynucleotides are also involved in that cellular communication pathway. And then microneedling allows all of these incredible products to really go through. So this is what's happening. It's a lot more than just losing your fat, but the good news is we can address them with regenerative treatments here.
I learned a lot.
Oh, good. Yeah.
I thought I knew a lot about it. Apparently not.
Well, that's what I'm here for.
Yeah.
And so these are, actually, I did a podcast today, and it's for the San Diego Academy of Regenerative Therapies. This is an incredible regenerative medicine, symposium. Global leaders in the field get together, and this is going to be my topic. And this is really something that really needs to be, taught. We have to talk about this.
So I was talking to one of my good friends, who's an internal med physician, and I was asking, I was like, is this something where you could be on it forever? And he's like, nobody knows. Yeah. Nobody knows the actual long-term effects of GLP-1s. Because I was like, could you technically go on like a maintenance dose? And he's like, we don't know.
Yes, and most of the large-scale studies done on GLP-1s are for those with metabolic syndrome, they're really highly overweight, who are already diabetic or definitely are insulin resistant, and are at high risk for heart disease and other issues from diabetes. A lot of people out there are microdosing
Mm-hmm.
GLP-1s around menopause, weight gain, or they just want to fit back in their clothes they used to fit in. They can, working out, doing everything, and
Yeah.
they can't lose it. They're microdosing. There's really no long-term data yet for that, and we don't know, like you said, can you just get to your desired weight and stop? The studies are showing, though, some of the kind of preliminary things are showing that when you stop, you gain weight very fast.
Yes, so
And
that's kind of
Oprah
like
actually went
she talked
when
about
she
that,
talked
didn't she?
about that, yes, because
Mhm.
she's like, whoa, I'm on my goal weight. I'm just gonna eat well, exercise the same, but she gained weight.
Yeah.
She gained 20 pounds. She
And
said,
that also proves too that there is something metabolic happening,
yes,
right? When you are on the medication, it's not truly just like the fat loss itself. It does change something within your body.
right.
So when you are not on the medication, you actually will go back to your kind of your perhaps your normal state.
Baseline.
But then also speaking about long term, there was also something that I had heard that even when you stop the medication, the issues that you were talking about cosmetically may not reverse or go back. So
Yes.
talking about skin on the face and then also like hair.
Right, right. And we'll talk about that.
Mhm.
And the key to this, anything with
Yeah.
aging, with hair loss, no matter what, is to be proactive. And if you are thinking about, going on a GLP-1, if you already are, you
Mhm.
really need to address these things right away.
Yeah.
Get treatments right away, and don't wait till you're kind of on the end of the road. Next, okay. All right, so now here at M Beauty Clinic, we're introducing a specific regenerative stacking program we're calling GLP-1 Region Code, which addresses everything, stimulates collagen, improves blood supply, restores cellular signaling, and we're going to combine different devices and modalities
Mhm.
to do this, and we'll show you guys here. Let's see, okay, combination therapy, and and this is not necessarily on GLP-1 patients, but the concept is the same in that, we're introducing energy, this is Phil Blauer, which is energy, a laser. We did a lot of platelet-rich plasma for him. We also did platelet-rich fibrin matrix for his under eyes. That's a big area that loses volume.
Yes.
A lot of people who have weight loss, and that's kind of like a giveaway. Like when celebrities start having really sunken eyes, or their eyes are bulging out because
Yes.
there's no more fat support around the
Mhm.
eyes, then that's a big area. And here, so this is our laser, the Vidance dual mode.
We do
Angela
love that.
loves this laser.
It works so well on patients. They love it.
And you can see there's a smoke evacuator. You can kind of see there.
Yeah.
We really are vaporizing the old skin.
Yes.
So
Yeah.
so this will help the wrinkling, the texture, the pores. When you lose weight, if you had acne scars when you're younger, it's going to be more noticeable. So this, we can target that as well. And so then after we finish with laser, and
Great.
depending on your skin type,
This is
obviously
a smoke
Phil is
evacuator.
Fair skin.
fair skin, but we have all of the different
Because
technologies here that we can
are
customize it based on your skin type.
actively
If you
vaporizing
have darker skin,
the
We have
skin.
so many lasers, and that actually like is a big key thing that I do
Next
tell
slide.
my patients, that when we are recommending treatments, we're not just recommending the one thing that we happen to have, right? I am telling you, we have so
Next
many
slide.
different treatments, and so we are really able to tailor it to you for your skin type, your downtime that you have, and also for what your goals are as well.
Yeah, let's go next slide. Okay, so here's a patient who has skin of color, and it's an incredible improvement. And you can see that it's not just the laxity, the hollow in her under eyes, the nasolabial fold, the marionette lines, and that happens when you lose weight, the temple hollowing, and then the neck laxity, wrinkles. We can restore everything and in a single visit with these combination
Even the
treatments.
glow, like just look at how
Healthy, right?
yes, her skin looks healthy, it's glowing, the light is reflecting off her skin. Like it's it's completely changed.
Yes, and that's it. And a lot of people on GLP-1s, you really see the skin does not look healthy.
Yeah.
We can tell, like we're so good as humans to be able to tell healthy skin, the
Yeah.
healthy look. And we can restore that. And that has a lot to do with blood flow,
Yes.
has a lot to do with hormones, has a lot to do with cellular signaling. And we are able to restore that using these regenerative stacking treatments like the time machine procedure. And so here she is. And, you know, we also did a light resurfacing on her, but this part I'm just going to show you. We are microneedling. There's the syringe on my hand there. Go ahead on that one. This is microneedling. And then this is her platelet-rich plasma. So platelet-rich plasma we've been using at M Beauty Clinic for 15 years. It's just kind of becoming like mainstream now for practices. We started this.
Yeah, actually.
We really did. We were one of the first, if not the first, to combine energy-based treatments, microneedling, and platelet-rich plasma. Because really, that's been our philosophy. Is, you know, we were really getting to the root of what happens with aging, and then with, you know, GLP-1 weight loss as well. So
I'd also like to point out that you may go to practices that only apply the PRP topically, but we also inject it, and that's very important when we are trying to do volume restoration in a more natural way, in a more regenerative way. So we also inject the PRP, and we are so comfortable with it. And we're experts in it. Again, like Dr. Tess was saying, we've been doing this for 15 years.
There it is. So we use what's called platelet-rich fibrin matrix. I really do not like fillers for the under eyes. Actually, today I saw 2 patients who had problems with their fillers in their under eyes. They had their doctors dissolve it, and it created so much hollowing, so many more wrinkles. And now we're going to do this combo procedure with PRFM series to rebuild the damage, to rebuild natural volume. So be careful with fillers there. I mean, when you get a problem, the first time she had fillers done, it was 6 years ago, and she's been chasing it. That nodules, lumpiness. And if you get really unlucky with a hyaluronic acid filler in the under eyes going in your blood vessel, you can go blind. Platelet-rich fibrin matrix is how we maintain, this is how I maintain my under eyes, my temples, and natural volumization. You will never look unnatural, and that's really a promise here. And then when we now have these channels from the energy-based resurfacing, microneedling, then we apply these incredible products that will deliver like salmon DNA. This one is Regerin polydeoxyribonucleotide. This again helps with the cell-to-cell signaling. It helps with inflammation. It helps patients heal faster, and it helps them get much better results, and you get that healthy glow. And then we also use exosomes. Next. And then for some patients, and this is our job, is when you come to see us, we will put together the different technologies, because like Angela's, we have so many. That's really the advantage, because, you know, if you go to a place, they only have one device, every single patient is going to get that. But here, you know, if depending on your downtime, your skin type, your skin color problem, we can put together different.
It's very, very tailored to you.
Yeah. This one is radio frequency microneedling.
The biggest mistake people make when starting a GLP-1 is waiting too long to support their skin. Now, just to clarify, I'm personally not on a GLP-1, but I do have a lot of patients who are, and others who are simply interested in skin tightening with minimal downtime. And that's where the Matrix by Candela
types
comes in.
of
It's an
radio
FDA
frequency
cleared complete skin
microneedling
renewal system
devices,
that naturally
not just
stimulates
one.
collagen
We have
production,
3
featuring
different
a radio
ones.
frequency
And
microneedling to tone, tighten,
and
improve
essentially
texture.
the
Not to
needles
mention it
go
uses some
in.
of the
There you
thinnest
go.
microneedles on the
Delivers
market,
radio
so it's
frequency.
very
We can
tolerable with
control the
minimal
depth.
downtime. And I really
You
love
can
how the device has a
use
built-in
it for
safety technology
tightening.
that
You can use it
monitors
to
skin
deliver
response, and
your
it's safe for all skin
PRP.
types. And that's why I'm testing it out today
Exosomes.
myself,
Here, I think
because
we're
if I'm thinking
putting
about bringing
exosomes
something
on
into my
her.
practice, I always try it
It's
first,
really,
because when your
really
face is
amazing. And
changing,
for
supporting
skin
the
of
collagen
color,
early can make a big difference.
this is amazing. Next. NanoFat, let me just mention a little bit about NanoFat. For those of you who want to use your own stem cells, I can harvest fat under local anesthesia. I just did that. Was that yesterday, Lise? That was just yesterday.
Yeah.
Yes. So I have a patient who comes every year, and this is kind of her routine. I'll harvest a little bit of fat, and then we'll use it. We'll do the whole time machine procedure, and then we'll use NanoFat to deliver not just your PRP, not just exosomes, but your own stem cells. It's amazing. And so it's fat, like I mentioned, it's rich in growth factor, stem cells, has anti-inflammatory properties, and it gives you that beautiful, healthy,
it really does. What's interesting is when you do use the NanoFat and we incorporate it into the time machine, those time machine patients actually heal faster.
For sure. That's why
it's very special, that NanoFat.
Yes, that's why our patient, we can go very aggressive on her laser treatment, and she always is fully healed within a week. Oh, yes.
So there's a question that says, well, where do you harvest fat if you lost fat?
Well, it depends. She's actually very thin. We always find some. You don't need a lot. This is not a full lipo. This is literally like harvesting, unless you're like your skin and bones, I can find fat usually like a little bit here in the hip is the most common. But yesterday we actually harvested from her knee.
Okay.
There's
like so that's how little.
Yeah, that's how little you need.
Okay.
Yeah, you don't need a lot.
The question is also, what is the downtime for lasers?
It depends. So it depends on how aggressive we go, how many passes. There's so much artistry that goes into that. So the best thing is you come in for a free consultation, and then we'll evaluate. You tell us. Sometimes they have to tell
us. Exactly. I'm like, do you have a week? Do you have 5 days? Do you only have 3 days? So we will have to tailor the treatments we do, and then also how aggressive we perform it. So again, very, very tailored. It's not a one-size-fits kind of thing.
The advantage of actually having all of these regenerative products, PRP, exosomes, PDRN, and even NanoFat, like we mentioned, you can get a more aggressive energy treatment, laser, RF microneedling, whatever it is, more aggressive than, say, someone is just doing the laser alone. And we've done half-phase studies with this. This is why at M Beauty Clinic, we hardly do just laser alone, because we know your downtime, your experience and journey and your result, it's going to be so much better.
We have someone who says, I want to acknowledge M Beauty because I went in for my time machine earlier this month. Nurse Angela was professional and gave me all the tools before, during, and post procedure. I appreciate the numbing laughing gas during the procedure. I also needed extra healing tensage and the carbon dioxide, the CO2 mask that helps with the speed up my recovery. I highly recommend time.
Oh, you're so sweet. Thank you.
Thank you so much.
Thank you.
Yes, and we are so specific on the products that you use, and all over the products. So she mentioned CO2 lift mask, which is carboxytherapy. We talked about blood flow, and that's like a hyperbaric chamber in the skin. So that's very important. We incorporate that. Tensage is a growth factor from snails. The snail growth factor. So that accelerates healing.
It really, I mean, like all of these things, like they're not.
We send you home with the exosomes.
Yes, yeah.
So we're always constantly innovating our post-care treatment because it makes a difference. So thank you for acknowledging that, because
also, if you've had time machine 10 years ago, 5 years ago, 2 years ago, it's not the same time machine that we do now. Also, I do want to bring that up. Like what you were saying, we are always evolving, and we're always looking for what the best treatments are, what the best products are, even numbing cream.
Yes.
Even
and
that gets
nitrous.
Nitrous,
the nitrous you mentioned, Pronox. Not a lot of practices offer nitrous gas anesthesia. Here, we offer it. We include it in our time machine procedure.
It makes you more comfortable. So that's the other thing. We don't want you to be scared of pain. So we take many measures to make sure you are as comfortable as possible.
Right. So thank you for that. And actually today I saw a patient who had a time machine procedure over 10 years ago. And it lasted her a long time.
Good
and she's like, yeah, I'm due for another one. And so, yes, people ask, how long does it last? I tell patients, even if you just do one time machine in your lifetime, so you reset the aging at your age, and that is now where you're going to start your aging process. And then if you do maintenance, you just really slow down the aging process. Next. Okay, so speaking of different ways to build collagen. This is the latest. If you know, Zerf, it's everywhere, and I really am very proud to say that we helped pioneer this in the United States. We're one of the first, and I've been recognized in the Hollywood Reporter and New Beauty as one of the pioneers of this. It's very important when you go, when you are thinking about non-invasive, these types of energy-based treatments, to go to an expert, because your absolutely your results will be impacted by who's doing it and the technique.
I would definitely say, yeah, there's like the person who is performing the treatment, that does matter, because there's different things that you can do to make it more effective. And so on the reverse, there's also things that you can do that maybe make it not as effective. Right. So I would say that comparing price is not necessarily like the best way to figure out if you're going to go to the best practice. But again, like, I do feel that with Zerf, we've had so many happy patients, like thankfully, like us. Yeah, I'm like, I love the Zerf, honestly, like for myself. But even like the patients are so pleasantly surprised with it. It's comfortable, and there's no downtime, and it is very smart. Also, let's just be honest, like South Korea, they're just like really doing amazing with like in the beauty industry.
Anyone can figure it out. It would be Koreans.
And they did. So yeah, so this device is one of the newest to come out from South Korea, and we completely endorse it. It's a wonderful treatment.
Yes, and here another one who tried it. So I will be doing a live Fox 5 News segment with Maria later.
This can't be
and
that works,
you know, she's open about her age. She's in her 50s, and obviously aging in public, right?
Oh yeah, in the public eye. Yeah, she is on TV in San Diego 5 days a week.
Yes, look at her. This is her immediately after her hydrofacial. And look at her, no makeup, no filter. Thank you, Maria, for being so brave, you know, and that's really her. You can see her neck. She's
what
just
I noticed the most was here.
She's saying,
look at that.
Yeah, she's totally snatched. And I'll see her tonight. And you guys can watch. We'll be on live at 7:30 on Fox.
She doesn't sleep. You know what I mean? She doesn't sleep. Who needs sleep?
So important. These message. The message is very important. Everybody has to know.
She's doing.
I'm on a mission.
She's on a mission to spread the word.
Exactly. I feel bad for James, my husband. Okay, next.
Right?
Oh man, you married a good man, because like, so James, if it wasn't you who was going along, I would have to be tagging along with Lisa.
It would be.
Thank you, James.
Yeah, you two should thank James.
You're welcome.
Okay, and so the cool thing about Zerf, you can use it on all, like, you know, skin types and busy people, media people, celebrities. Tracy Toms is an incredible actress, singer, and it's amazing because she will be seen on the big screen for Devil Wears Prada. I got her ready for that. I got her ready recently. If you go on her Instagram for her 50th birthday, she looked amazing. And so now she's doing all of this media and press things and no downtime. So she's done the time machine procedure before.
Yes,
actually, the Hollywood Reporter covered her transformation. And she was able to do that during COVID because they weren't filming.
Yeah.
But after that, she doesn't have any more downtime. And that's her immediately after. Here's her treatment. We put the strongest topical.
This is
that
Zerf. Zerf is radio frequency, monopolar radio frequency. It's
Can they hear the
non-surgical,
audio?
no downtime.
They do? Okay.
It's structural skin
tightening.
tightening.
Here's tomorrow.
So it's
Yeah,
gonna be
Look
great.
at you,
but the
literally
best
got
thing is that
ready
it's
for like red
actually
carpet. Baby.
not
Yes,
painful, no
and
needles, and
so
you can go
she
to
loved
any
it.
event tonight.
And
It's
so we put a little
perfect
ultrasound
because she's
gel,
going to be
very
attending
relaxed.
a lot
You
of
don't need
events.
nitrous for
For this movie that
The one thing I do want to point out is what's
You've heard of
nice
it.
about Zerf is you do get immediate treatment, but technically full results happens later. So you're going to look great immediately, and then it will continue to get better over time too.
We're all finished with Zerf, and now Tracy is getting IV glutathione and vitamin C.
Here it is right here.
These are incredibly powerful antioxidants, so they help just give you a boost of energy. It helps your cells, protects your cells, and it boosts your immune system. It also gives you a skin brightening effect, which is amazing. Gives you a nice, healthy glow.
Okay, so we're finished with the Zerv. We're finished with the glutathione injection. Is that everything? Is that it?
That's all.
That's all. That's her immediately after. That's all.
Cute.
All right. And so these are some of the results next. Just improvement, and again, you don't see as much of kind of like the instant resurfacing that you do with the laser. All right. And then this is our friend Philip B, who we treated one side of his neck. He's done everything before, and let's see. Yeah, do this.
Ready.
Watch. So if I pinch the side that's not treated, you can see how it doesn't snap back. Now look.
Whoa.
See that? It snaps right back.
Snap.
Look at that.
Oh, snap.
Look at this.
It's the snap
Snap,
test.
snap,
I love it.
Snap, snap. I love it.
That's one of my favorite videos.
Yeah, and he's so amazing. All right, so we also have Softwave. We love Softwave as well. We've had it since 2022. It does have
one of the first in the nation to
exactly.
have Softwave too.
So we have both. So
Yeah.
there's some patients, certain indications, certain areas where we would pick Softwave. Sometimes we combine both on the same day. And Softwave has an FDA clearance for skin tightening of the arms. And so here, the tube there that you see is the nitrous Pronox. With the nitrous gas, you can be a little bit, under anesthesia while we're doing it. You can control how much anesthesia you get, and then a few minutes after you stop inhaling, you can drive.
Yeah,
so
that's
what's
awesome.
Great about that. All right, so we'll just go quickly with hair restoration because I gotta go. I did a Fox 5. So we have lasers. So for hair, combination
right?
therapy is also the best way to approach it. This is the Pro Deep laser, and essentially we're increasing blood flow to the area. We're activating the hair stem cells, increasing cell-to-cell communication, and activating the regenerative process. This is a painless laser, and you can use it on all issues as far as hair loss. And this is type of results that you get. Again, combination, we also treated him, I think, with PRP injection. So platelet-rich plasma is not just good for the skin, it's also good for hair. And it's very important to do this with nitrous. There are a lot of places that offer PRP injections without nitrous. I wouldn't recommend it. But here at M Beauty, you don't have to worry. You can be under nitrous. So platelet-rich plasma is injected there. We can also microneedle it. We can also microneedle exosomes. So there it is, platelet-rich plasma from your blood. And then here are some nice results.
So what's nice is that was a female. So I do want to note that we also can do female patterned hair loss as well.
For
specifically, postpartum.
Right. For postpartum GLP-1 hair loss, which tends to be more of a shedding because of the change in your metabolism and nutrition. Next. Right. Okay, so then let's talk about how do you plump up the skin that's kind of gotten drier and older looking. And there's new ways to deliver hyaluronic acid and peptides in the skin. And our Self is pretty cutting edge in a special tiered release vesicle. And so it's regenerative because you can actually deliver it and it can get to where it needs to, which is the dermis. So it has vitamin C, niacinamide, and hyaluronic acid. So obviously hyaluronic acid, the fillers that we use are made of hyaluronic acid, but you can, deliver hyaluronic acid for your whole face, your neck, Also, you can get, there's an eye product as well and a lip plumper.
It's pretty nice. Like it makes the areas look very supple. And that's what I love about Ourself for the lips, the under eyes, and the skin itself.
Yeah, because hyaluronic acid attracts water, and that's how it works. This is a must. Every single person in the world has to use this. And when you lose weight, you do lose volume in your lips. You accelerate that. That's a normal part of the aging process, but you accelerate that, and you lose volume there. And if you're not ready for injectable fillers for your lips, this is
definitely the one.
Yeah, I use this religiously twice a day, and these are the kind of results. It's very subtle, but there, I mean, it's not going to change your lip shape. You'll not look weird. You'll just look like a younger, plumper version of you. And even younger, I have patients who are buying this for their daughters who are thinking about doing the injectable, and then the moms are like, "No, I'll
try this first."
Exactly. I
personally do both.
Yeah, you can absolutely do both.
I do filler and I also do
and it does maintain your lips, so maybe you don't have
definitely. It stretches out the amount of time.
Yeah, I was gonna have you inject my lips, but then I found Ourselves, so
Thank you.
Yeah, next. And then let's talk about Extra Stay. It's the first and only stress adaptive hair health product. It's a whole system, actually, and it addresses all of these, which happens when you're on a GLP-1, weight loss, life, menopause, motherhood. I mean, just everything.
All of it.
Aging, we will lose hair. If you love your hair, you don't want to lose hair, you got to be on this system. If you're already losing hair, hurry up because you don't want to lose more hair. And so there's the gummies, and this is amazing. It's drug-free, 2 a day. It's so easy. So definitely increases the compliance, because if you cannot take those giant pills, take the gummies.
Gummy, yeah, and they taste good too. Very easy to take.
Yes. And it has a peptide, and then now they actually, it's here. I've been using this. So they have a peptide complex here. It's a concentrate. Ooh, I like it. And the cool thing about this is that a lot of products for hair loss or hair restoration, it messes your hair up. It either makes it like clumpy, or it makes it, what do you call this? It messes up your hair. But here, see, I'm going on Fox and I'm putting it on. And just put it right on your scalp. And it doesn't really mess your hair. So you don't feel like you have to take a shower. Yeah,
it's just weird. It does go on
totally disappears.
Interesting.
Yeah. And you don't need a lot because it's very, very concentrated. It has peptides. It has the X3 bioactive blend, which is also in your gummy. And it's targeted follicle repair.
Is this yours?
Yeah, don't steal it. No, we're going to get more. I ordered a bunch. This one is mine. I just brought it here.
Dang it.
But you guys need to do this. And then for those who are serious, so maybe if you are seeing you're actively really shedding, you really want to do your best, then we'd recommend doing the laser. And this is their highly concentrated exosomes. So it has trillions of signaling molecules. Remember, that is very much involved in regeneration. Hundreds of billions of exosomes, hyaluronic acid, growth factors, peptides. It is decellularized, so it's not like you're getting someone else's cells in you. And we micro needle that. I had that done. So my scalp is still a little reddish here. I had it microneedled maybe 3 days ago.
Man, for someone who's been in the industry for over 20 years, that is like groundbreaking. That's very cool.
Right. So these are the results that they're getting. And this is really perfect for more of the female pattern alopecia, which is more generalized thinning. Because we can really...
And more like scalp show, if you kind of notice more if your scalp is showing.
Right. Yeah. So, okay. And that's it. So it's a whole complex. And then I have to run because I got to go to Fox. I will leave the rest to Angela.
Oh, good. Thank God. It's just the raffles. I was like, oh, I hope it's nothing science-y. Oh, boy.
Okay. Just want to announce here in this next slide.
You want to come in with me?
No.
Here, show these.
Well, sorry. Right here. So In regards to Extra Say, we are going to have a pop-up Meet M Beauty Clinic team at Fashion Valley Courtyard on Sunday, May 24th.
Oh, that's what we're doing.
To 6 p.m. There's going to be a little trailer where you're going to have samples. There's going to be a cotton candy machine.
There is?
Look at and also
Will I be there?
Fun.
there's
Come
going to
on.
be a Vespa photo op.
See you guys.
It's going to be really
Catch
cute
my
and
segment.
cool.
7:30.
7:30, Fox 5
Yes.
News.
Yeah, so when you jump
With
off here,
Maria.
jump off here, and then you're going to go see her on Fox 5. Okay, so yes, please come see us in Fashion Valley Courtyard on Sunday, May 24th, from 10 a.m. to
Wow,
6 p.m.
cool.
All right, so next, Angela, special.
All right, so we have very good specials, especially for our attendees, which thank you so much, first of all, for attending our Zoom. We always appreciate everyone's support. After probably tomorrow or so, we will announce the winners of the Zoom, and also you'll get an email.
Yes, it'll say the next slide.
It'll say in the next slide. Okay,
But-
perfect.
But for now, for the special,
So Extra Say, buy 3 for $206. That's actually a really great
yeah, because
deal.
1 in 78.
Ooh, 1 is 78. So yeah, that's a very good deal. Or like if I was an influencer, I would do this. Right? Okay, then the Our Self lip kit. So the best lips set, $210, and you do get 2 conditioners for free. What?
Well, there's 3 inside of it, but the value is you're basically getting 2 conditioners for free.
So meaning like you get
You get
the
30.
one that has that, and you're saying you get 2 cartridges additional?
No, you get no. So you're gonna get one of the. You're gonna get one of the. Oh, it's not even here.
Okay.
Anyway, you're gonna get one of the lip filler
Mm-hmm.
and 3 conditioners. It's because
Oh,
it's not
the
it's
lip
not-
glosses.
Yes, it's not a moisturizer. These are conditioners. It's not your Aquaphor. This
Yes,
is
yes.
basically helping.
To promote
Remoisture, yeah,
more
remoisture.
suppleness and more moisture
Yes.
into the skin.
So that's
Oh,
what,
okay.
and a cute little bag too.
Oh, the Ourself stuff is so cute. Like, look at this box. How cute is this box, by the way? And then you also get face firming duo. So that's another thing.
And that one's a 20% savings.
Okay,
Face
okay.
and eye. So you get the face and eye for the face and duo. And then when she discussed the Vitamin Pro-D for the hair, and also it also helps for the face. The Vitins also helps with the explain a little bit for the skin, right? It can help with texture, tone, a little bit of
Yeah, so the Vitins machine that you guys saw that we were
on the scalp.
doing on the scalp, that also can be used on the face. So we can do it for active acne scars that are textured. You can do it for pores. And also I've done it just in general for patients who just want kind of a general rejuvenation to the skin. They maybe only have about 2 days downtime, but they want to check off a lot of boxes. Brightness, tightening, pore size reduction, wrinkle reduction, almost just kind of like a get ready for a party kind of thing. So that's a pretty good one. I highly recommend that if you've never tried that treatment. So the other special is Zerf. So Zerf face and neck, $2,500. That's a super good deal, and it's
3,000.
regular 3,000. So you'll save $500 off Zerf for the face and neck with RN. And then Jeuveau, ooh, this is a good one. So by the way, everyone hears about the name Botox, right? And I do feel that the stigma about Botox is getting better, but we can do a little bit better than that. So now we also offer Jeuveau. We were also one of the first in the nation to offer Jeuveau. I personally use Jeuveau, and I recommend it for my patients. It gives a more natural look. The feeling of it too is very natural. It gives a softer look, and we can do it to where it is virtually undetectable. So Jeuveau can be used for the upper face for wrinkles. We can use it to help lift the eyelids, lift the brows. We can do it for a lip flip. There's a fun little treatment called Nefertiti lift, and you can do that along the jawline and on the upper neck, and that helps to lift the lower face. You can also do it for hyperhidrosis, which is excessive sweating. So we've done that on armpits, on hands. Also, I get this done. Masseters. So for patients who tend to grind their teeth, you can do it for here. Also, if you get migraines, then I'll try to pinpoint exactly where your migraines are, and I can inject typically here, above the ears and the temples. So yeah, like come get a consultation. There's a lot of places that we can use the Jeuveau. So 100 units can sometimes go quickly. So buy 100, get 20 free. What's next? Okay, this is the fun part. So Extra Say hair gummies. Here we go. So you can win a package of the hair gummies, which is a $78 value. Another person is going to win ourself Advanced Renewal Serum. Right here, I use this day and night on my face and neck. Again, if I was an influencer. And then Jeuveau, 20 units. So 20 units, we can use that for the crow's feet, the frown line. We can do some in the jawline as well. There's so many places that it can be used for. And again, we can make it undetectable. So again, 3 lucky winners from our attendees today. We will contact you via email, and also please follow us on Instagram at mbeautyclinic.com, and also follow Dr. Tess and see wherever the heck she is in the world and different places that she's educating doctors. And also you can get great information as well by following her, and follow her Instagram at Dr. Tess Mauricio. And I think that's it. If anybody has any questions, I'm going to give you 5 seconds. Oh, you're welcome. And I think I had some friends on here too. So if you guys ended up watching, I think I'm going to call out Sylvia, Sam, Greta, and Arena. Thank you guys for watching. And hopefully you will catch us on the next Zoom. Okay, signing off. Bye. Have a good night.